On behalf of Hep B United, welcome. We will be chatting with our guest speakers today who are going to share their experiences in screening communities across the country for hepatitis B infection. And we'll be chatting about things such as event outreach, follow-up, and linkage to care. First and foremost, you'll see all of our speakers on screen today, and I wanted to go ahead and introduce them. First, we have Ms. Jane Pan. Jane, if you could wave.
Hello.
Jane is the Executive Director of the Hepatitis B Initiative of Washington, D.C. Jane oversees HBIDC's research projects, outreach programs, community engagement, and organizational development. Next, we have Ms. Sherry Cohen.
Hello.
Sherry is the Director of Public Health at the Hepatitis B Foundation. For over 14 years, she has planned and implemented and evaluated community programs and research projects focusing on hepatitis B and liver cancer. Sherry is also the co-founder and director of Hep B United Philadelphia. And it's a coalition and campaign to increase testing, vaccination, and linkage to care in Asian American Pacific Islander communities in the Philadelphia region. And next we have Dr. Bin Tran.
Hi.
Hi, Bin is the co-founder and executive director of the Asian Pacific Health Foundation based in San Diego, California. It's a nonprofit organization, and Bin has worked on hepatitis B prevention and screening in San Diego for the past 13 years, which started with a California endowment grant in 2003, and then transitioning to the foundation where she focuses on Hep B screening at health fairs and outreach events in the community. And finally, we have Dr. Hong Liu.
Hello.
Dr. Liu is the executive director of the Midwest Asian Health Association based in Chicago, Illinois. Dr. Liu has dedicated her career to public health, having worked with several nonprofit community-based health organizations toward improving the health and quality of life of Asian American populations. And before we get started, I wanted to go over a quick housekeeping rules. If you do hear an echo, please feel free to switch over to your telephone, and the call-in number is there on your screen, 323-920-0091, and the access code is 733-4209. Also, we will be taking questions throughout this discussion. Due to the amount of attendees we have online, we have to mute attendees to reduce the background noise. So if you do have questions, please feel free to submit your questions in the left-hand corner in the chat box. And you may direct your questions to the presenters. Great. So why don't we get started? I'm going to go ahead and ask each of our speakers a introductory question so we can get to know more about your organization and the communities that you serve. We're lucky to have an array of a representation of our coalition members who represent our geographic communities across the country. And I'll start with Jane. Can you take a few minutes and tell us about your organization's history and mission related to addressing hepatitis B and the communities that you serve?
Sure. Thanks, Kate. HBIDC is a nonprofit organization, and we started in 2006 in the DC area. But before that, HBI was founded by Leslie Hsu. She lost her brother and her mother to hepatitis B while she was going to a school of public health at Harvard. And so she started putting out flyers in Boston, Chinatown, and that she figured that she thinks that no other families should have to go through what she went through. So that's how HBI Boston was started. And in 2006, she moved down to the DC metro area and then started the HBIDC.
Great.
So, I've been with the as an executive director with the HBIDC since 2009, and the communities that we have served is we started with the Chinese, the Vietnamese, and the Koreans, and then every year since then we have tried to outreach to a new community. So we've reached out to the Filipinos, the Laotians, the Burmese, and the African immigrants, the Hispanic, and the Islamic and the Muslim and the Thai. And this year we're going to focus on, well, actually 2015 now going to be. We plan to focus on the Bangladesh, the South Asians, and the Cambodians.
Great, wow. That is a very diverse community you have in the DC metro area.
Yes, yes. We're very fortunate to have the diverse community around here.
Great. And what about you, Sherry? Can you tell us a little bit about the Philadelphia region?
Sure. So the Hepatitis B Foundation's in Doylestown, Pennsylvania, and there's 3 branches. There's the research branch, which are our labs that are in Doylestown, and then the outreach team is also up there, and the public health team. We were nationally focused and internationally focused for a while, and then in the early 2000s, we started realizing that we wanted to understand more about what was happening in Philadelphia. We were taking consult calls and doing bits of research and outreach and patient education around the country, but we wanted to focus more on what was happening in Philly. The assessment and the resources assessment for a few years in Philadelphia to figure out what the scope of the problem was and how we could help, what could be done. And what came out of that was, number one, the idea that, yes, there was a big problem. We have very vibrant immigrant community in Philadelphia. Immigrants from over 50 countries have participated in our screening since 2007. And so not only did we realize that we had a hepatitis B problem, but we also have a ton of resources that could help address the problem. And we were able to put together a coalition of people. It started very small, less than 10 organizations who were interested in addressing hepatitis B by working together. Now we have over 75 organizations in Philadelphia, and we've been screening and doing vaccination education and linkage to care since 2007.
Wow. Great. And let's hear from, and I'm going to click through some of these and we can go back to them later. And I just wanted to go to, since we have an intro slide from Chicago, Dr. Liu.
Hi, thank you for inviting me to now the organization is called Western Association, MAHA. We are located in Chicago, Chinatown area. This organization was established in 2003. I became the executive director starting 2009. And we primarily serve the Asian population, but focusing on Chinese community because the Chinese population is the largest population in Chicago. We have been doing the hepatitis B outreach, education, screening, immunization, and the patient care since 2012. We have established infrastructure for providing education, screening, immunization, and patient care. Our mission is to improve the health and the well-being and reduce health disparities for the Asian and Pacific Islanders in Chicago and in the Midwest. We have screened over, in the past 2 years, we have provided hepatitis C screening to over 1,500 clients and provide patient care to over 500 patients and immunize over 250 clients. And we have been working with the coalition members, the universities, city and then public health department, and CDOs collaboratively to all these activities.
If you could put, there's a little bit staticky. I think there's some background noise, or you're coming in and out. If you could adjust your mic.
Okay.
And we'll move on to California, where we have Dr. Bin Tran. Bin, if you could tell us a little bit about the foundation and also the communities that you serve in San Diego.
Thank you. This is the Asian Pacific Health Foundation, and we continue on the work of the Asian Pacific Health Center, the first community clinic founded in 2001 by a group of physicians and health professionals who saw the need for low-cost health services for the non-insured groups in San Diego. So I have worked on hepatitis B prevention and screening in San Diego for the past 13 years, starting with the California Endowment Grant in 2003 that lasted 2.5 years. Then we transitioned into the APH Foundation, where we focus now on hepatitis B screening at health fairs and outreach events in the community. So far, we have screened more than 3,700 persons since that time, and the rate of positive is about 6 to 6.8%. Since 2010, we collaborated with Dr. Robert Gish on the barrier study and some point-of-care studies with the pharmacy students at UCSD. And we also have a sub-award from the UCSD Antiviral Research Center to work on early detection of Hep B in foreign-born and at-risk people in San Diego County on a grant by the CDC. Yeah, so this is the CDC. We can talk more about that. It is a big program, and they have screened 7,500 subjects, counting for hepatitis B and C. So we are concerned with Hep B for my work. So we have more than 1,000 screened, 33 subjects test positive, which is about 3.25%, and 18 were linked to care. Okay. Since 2003, I am a member of the National Task Force on Hepatitis B, with focus on Asian and Pacific Islander Americans, and regional director for the South and Southwest region. In 2012, I joined the Hep B United Coalition and have participated actively on most of the calls and the activities of Hep B United. Great. Yeah, those are pictures of pharmacy students who are an integral part of our efforts. Great. On that picture was events with the Tsuchi Foundation group, where they do osteoporosis as a side project. That way we can increase them to the Hep B screening.
Great. Thank you, Ben. And we'll talk more about the importance of partnerships, and we'd love to learn how that is where they play a part in your screening events. And we'd like to hear that from everybody. First, I wanted to start off just focusing on the actual process of screening. If you can all describe how you actually go about conducting your screening events. And why don't we go back to Jane?
So when we start a new community, outreach to a new community, the first thing we do is to try to connect with the community leader of that group. And the success of that, to get their buy-in, some of them would know. And so what we try to do is to get to the leader and educate them and get their buy-in. And then I'll just tell the story about this Thai temple group. So the story of that is I know Kate, and Kate know her mom, and her mom knows Robin, and Robin is involved with this Thai temple, and then and she's very, very helpful to help us to reach to John, and John helped us. John was very much involved in the Thai temple, and in fact he speaks Thai also. And then we started the outreach to the Thai temple, and we started the screening there, and we follow up with the people who tested positive, and we're following up with the vaccination. And so mainly each community that we go to, we try to connect with a community leader, and from there we can build the trust, and from the trust, then we can outreach to the community. And so this is how we reach out to each different community.
Great. And can you talk more about where you find how many people that typically come to screen, and where and how, I guess, where the language, where you find assistance with language?
Sure.
For those that need.
Right. So this is really the difficult part of the process, is we just never know how many people is going to show up, and then how many phlebotomists that we will need to schedule, and how many people that we need to help with the registration. To reach out especially the new communities that we go to. So we have to, and it's really hard to say, nobody can tell how many people will show up. Let's say for this Thai temple, they actually had sent out 1,500 email notices for this specific event that tied in with their Mother's Day celebration. It's a Thai Mother's Day celebration. And with the 1,500 flyers that were sent out, we screened over 60 people. And I would think that, we were kind of worried, because 1,500 flyers and 60 people, that is really hard to judge. But then, we learn from each community how it goes. And then the last time, just like last week, we went to a Frederick Health Fair, and we screened 188. And we've been there a couple of years, and so we know that we would do at least over 100. And but this year was the most that we have done in the last 4 years that we've been there. And fortunately, we had scheduled 6 phlebotomists, and we had scheduled, a lot of volunteers to help. And with the language barrier is usually the community the community that we're in, we try to get some volunteers that can speak the language, and we try to and we train them, especially with the HIPAA regulations. We ask them to sign a form that, because especially when we're in the temple or churches, everybody knows everybody. And so HIPAA, the privacy regulation is very important.
Right. So it really depends on a number of factors when you're dealing with communities, and also different communities, it sounds like, will turn out differently.
Right. Yes.
Yeah.
Yes. Uh-huh.
Sherry, have you had that same experience? Can you talk a little bit about how you've been conducting screening events in Philadelphia?
Yeah, sure. It took a couple of years till we really got our successful practices down. We were finding the same things as Jane. We never knew how many people would show up at events, and it took us a while to realize that certain places you'll do better at. What we've learned in Philadelphia is we do really well when we hold our screenings at temples or churches, and when we do it on Sundays, basically with the ceremony. So when people are going to pray, they're going to service, we do our screening right afterwards. And that tends to work out because people are there, they want to sit there, they want to sit and stay for education. And then so it allows us a formal place to do education for everyone so that they know what they're getting tested for. And then we set up the testing right after that. What else has worked is working with community-based organizations who are very well known in the community. They have a strong reach. They have a network where, if they announce that they're doing a mini health fair or a hepatitis B education session, they can get 50, 60, or 100 people in the room just by word of mouth and flyers, because they have a strong community tie. We, the Hepatitis B Foundation, could never reach out to those people on our own, to the community on our own. We're not entrenched in the community. And we've also found that the communities who are more aware about hepatitis B tend to come out more. And for that reason, you have to learn which communities might need more education and be a little bit patient. There were some communities where we needed to develop relationships and really do focused education in the communities for months before we could expect people to want to be screened. And then the last thing, in order to help try and get people out, we have used media. We've taken ads out in some of the ethnic media newspapers. And we have, and I know some of the other groups as well have done this, we've tried to bring in other services as well. So for instance, if we know when we're doing hepatitis B screening, we may also promote that we're doing blood pressure tests. So while people are waiting in line, sometimes the lines can get long. While they're waiting to get their blood drawn, they can have their blood pressure checked. And so people like that. And as long as you don't offer too many services and it doesn't get too overwhelming, it works out nicely.
Great. And and thank you for mentioning the ethnic media. I think we'd like to go into that more too, in terms of how everyone has been promoting their events and whether you have been using that. I just wanted to go to Hong next and talk a little bit about how you've been conducting your screening events. Do you also go out to the community, or do you have regular clinic schedules? And whether you also use community partners?
Yes, I think our strategy is a little bit different from other states. We have regular monthly hepatitis B clinics to do screening, immunization, patient care. We promote our services in the local media, and we distribute flyers to the neighborhoods, to the restaurants, to all kinds of events to recruit clients. And the screening we conduct is the last Saturday of each month. And the other strategy is to recruit clients is that we are not only do the hepatitis B screening, we provide a comprehensive health checkup, which includes hepatitis B screening. So when we require people to come to pre-register, and we have intake form, and we require them to complete the patient form, hepatitis questionnaires. So everyone has to be pre-registered with the information. When people come to register, we always ask, have you tested for hepatitis B? And a lot of clients, they thought we are asking if they have liver disease, so they always say, oh, no, I'm okay, I don't have liver disease. Sometimes that's their first reaction. But we say, the hepatitis B is a virus, and you have to be tested and with blood draw in order to know if you are the carrier or if you have immunity. We provide education right there. And then some people said they probably have they were tested for hepatitis B, but they did not know their hepatitis B status. So it's very interesting that people have tests but without knowing the status or do not remember their hepatitis B status. So we provide education right there. We screen about 36 months. After the screening, we will send their lab report to their home, and then if they are positive, we will call each carrier to come back to see our volunteer doctor. And if they don't have immunity, we will also call them to come back for hepatitis B immunization. Yeah,
Hong, you're also, if you could adjust your microphone, I think you're coming in and out a little bit.
I increased the volume. I don't know if it is better.
Yeah, it's a little bit better, I think.
No.
It goes.
I don't know what to do with that.
Great. So I'm gonna move to Bin. Bin, if you could talk a little bit about your screening process.
Okay. I conduct the screening events at the churches, temples, community centers in San Diego City and the county. We can go a little bit far also, 20 miles north or south. The Vietnamese Federation is a nice place, a central location. It's a place where we have health fairs with the participation of UCSD, pharmacy, and medical students. On this picture, it is done on the World Hepatitis Day, on a Saturday. So we commemorate that day, and that is the Vietnamese Catholic Center. And you can see the students and the volunteer participants who come to help. We screen about 40 or 50 at the large places like the Wesley Methodist Church, not that place. And at small place like that, about 25 would be the norm. Mm-hmm. And we have student volunteers who can speak Vietnamese and Chinese. And at the Cambodian outreach, we need to have interpreters. They charge fees. But for those ethnic populations, the best way is by word of mouth, because some people do not read. So the translator, interpreter has to come and knock at their door. So in order to get, say, 50, she has to knock at 200 people's houses.
Wow. Yeah. And you recruit? Do you recruit from your pharmacy students or volunteers from the community at large?
There are several ways. I have attached with the School of Pharmacy. So around the start of the school year, we have a large group of first-year students who are eager to come. So those are the time when they can go to the Vietnamese Federation. Later on, you can see the picture with that big building, and they come in great numbers. And the upper students, the upper years, kind of act as team leaders for the cholesterol, diabetes, med safety, and triglycerides group, so that it will benefit both ways. The community will get the help, free help, and the students can put to practice what they have learned in the classroom.
Great. That's a great way to involve eager young people, and especially build that healthcare professional pipeline as well.
Yeah. And we also have the bone densitometry, which is good, because we have the students who work on that topic for their summer research studies.
Great. So there seems to be a trend in really reaching out to the faith-based community, something that we in Health Disparities programs and policy know that's where communities of color usually gather for social events, and sounds like that's a great place to conduct hepatitis B outreach. And also it sounds like values the importance of community partners using CBOs, medical students, as well as individuals. And it sounds like businesses as well to promote your screening events. So that sounds really critical. I just want to take a step back. For those that are interested in conducting hepatitis B screening events, where would they start, even by finding resources to conduct screenings? How have you been able to find funding to to staff and also to equip your screening events such as phlebotomists? I'll start with Sherry this time.
Hi, thanks. That's a great question. So first, we tried to cut costs wherever we could and make it as cost efficient as possible. So we called labs. We worked with Quest, and they were able to give us a drastically reduced rate for both tests. So that's the first thing that we did, and that helped a lot. Second is we started to rely on our partners and community partners and clinical partners in particular to donate phlebotomy when they can. Very often if you're going to a church that has 200 people, some of the church leaders will be nurses and they'll be willing to donate their time working at the event. We've also been able to recruit nurse volunteers from hospitals. Now sometimes we have to pay for phlebotomy, and that's the one time where I think it's really important. When you're doing community events and you might have 50 or 100 people wanting to get tested all at the same time, you need to make sure you have the best phlebotomists, people who know what they're doing so that they can get through it quickly. And then we rely on volunteers to help cut costs as well. In terms of funding, we did apply to we were very successful with some of the local foundations. Barra Foundation, for example, is a local foundation in Philadelphia that is interested in working with vulnerable populations. We have Impact 100 Philly here. So I think something to do is for people to look at your community and see where the funders are. If there are corporations in your local area, in your city, they may have a foundation associated with them that you might be able to look at. I think making sure that you develop relationships with local potential funders or corporations or business leaders can be very fruitful.
Great. What about you, Hung? How does your clinic operate? How have you been able to find resources specifically for Hep B screening?
That is a great question. We are fortunate to have the funding from the Hepatitis C Alliance of Chicago, Northwestern University, which is a medical student-run organization. They send a proposal to the hospital for the hepatitis B screening, and we get reimbursement from them. Like Sherry said, we got a very good discount rate from the LabCorp with a minimum charge for the hepatitis B surface antigen and surface antibody test. And then we heavily rely on the student volunteers from different universities here in Chicago to help with to provide assistance with the screening and immunization. Our immunization, the vaccine is donated by the Chicago Public Health Department and administered by the University Pharmacies, the College of Pharmacy, and the students. So I think the combination we also write a proposal to the local foundations and the state public health department to have some funding to support the staff time. So it's a combination of volunteer, in-kind contribution, schools and public health department working together to have regular hepatitis C screening, immunization, and patient care program.
Wow. It sounds like we are really looking for resources anywhere, and it does sound like you'd be surprised to know that you can get discounted fares and prices on things such as lab equipment. Jane, what about you? Have you run into the same sources and able to get those type of resources for your screening events?
Yes, it's similar, and this is always a big struggle for us to have sustainable funding resources. Because every year we just don't know what is going to be like the next year. So most of our funding has been supported by. So we work in DC, and there's DC Mayor's Office of Asian Pacific Islanders Affairs, and they've been supporting us for the last 5 years. And also we also are a subcontractor with the Hopkins University for the School of Public Health, and they have a project with the National Cancer Institute. So it's a 4-year project, and that's part of the funding. And then pharmaceutical companies, and then research projects by some doctors who has some research projects going on. We also have a community foundations in the area, capital regions and the local regions. We have a little funding from there. And then we also do our own fundraising events.
Great. Yeah, it sounds like everyone has been able to find something, and it's very local to your area. Like Jane, being in DC, has been able to tap into NIH research, for example, and government resources. And finally, Ben, what about you in San Diego? Where do you find funding for your screening events?
Yeah, during the first year of collaboration with Dr. Gish, we wrote grants to Gilead Foundation and BMS and obtained some fundings. You know, we spent almost the whole year doing grants writing. And for the past 2 years, we got a sub-award from UCSD, which is ending last month. I try to save some of the money obtained so that we can continue the screenings. But then we are grateful for a mini grant from Hep B Foundation. And also Dr. Gish provided some partial support during transition times. About the in-kind services, we have some phlebotomists, volunteer from the students, but we still need a registered phlebotomist to be present, and we have to pay them. Mm-hmm. The role of volunteers is very important to handle the registration process because we have to have an IRB, Institutional Review Board authorization for the test, the study. So in the beginning, when we had both the barriers survey and the Hep B, the Hep Free San Diego form for the CDC, it takes a lot of time, and some patients do not like it. And our students who can speak other languages besides English are in much demand because we need to relay the information in the language that the patient understands.
Great. And I just want to transition a little bit, just to keep a time check on the end of the screening process. So once you get people, you promote your event and you get people to come to your screening events, whether it's in the clinic or it's at a temple or a community center, and then you screen them and you find folks that have already been vaccinated or different results. What's the next step? Like, how do people know what their results are? And what do you do with people who have tested positive for hepatitis B infection? And I'll start with Jane.
So we are very fortunate in this area because we are so close to NIH. NIH has many different projects going on, and this year they have a very, very good project, the Hep B for hepatitis B. So for those who tested positive, we try to first to see if they have insurance or not insurance, if they have their own doctor or not, and if they like to go back to their own doctor. And if they don't, then we try to refer them to NIH. This project that's going on right now, once they accept you, they don't check for a residency or anything like that. And once they accept you, they will do over 60 different tests, including cancer genetic testing, sonogram, and they also provide a year free of medication if needed. So that's my main linkage to care, and which has been very successful. And they not necessarily had to go. People are very scared about getting into NIH, and they have really actually worked out a system that is easier to get into. And they have also remote clinics in different area in Virginia, not in Virginia, but in Maryland and in DC. There's clinics where the coordinator will go to and meet with. And we also link at each of our events, we usually have a doctor who will support the screening event, and they will sign the lab request slip. And that will be the first doctor that we will refer those tested positive to. And we try to link all those who tested positive to care if they need it. And for those who needed vaccination, so we schedule a few vaccination events throughout the year in the 3 jurisdictions, in Maryland, Virginia, and DC. And the date is on our website. And then we try to call them every time to see, to remind them to come and get the vaccination. Sometimes we call and they said that, so many, let's say 22 people said that they will come, and then we end up with just 10 people, And then they'll call back and they'll say, oh, we missed the one before, and then where will be our next one? So we decided that if we just set up a routine vaccination event at different locations, then they all can, somehow that it will fit in to all.
Right, make it easier.
But it's a challenge. It's a challenge to get them.
Yeah. What about you, Sherry? How have you been able to address the linking people to care or vaccination?
So like Jane said, it's a challenge. So we tried to look at what some of the barriers to care were in Philadelphia. And in addition to finances and language, transportation was a big problem in Philly. So what we did was set up a network of physicians and clinics by neighborhood. And when we screen in a specific neighborhood, we then link those people to care to a clinic or physician that is close to them. So you have Northeast Philly, West Philly, South Philly, that kind of thing. Because one of the biggest issues we learned was that people were uncomfortable leaving their general neighborhood to go across town, either drive or by public transportation. So we have this network both of physicians who take insured individuals and then federally qualified health centers or free clinics. And we give people both options. We talk to them about both options. And in particular, we try and link individuals with providers who have staff that speak their language or have access to language line. And so that's worked well. We do multiple phone calls to try and figure out what a client wants, where they want to go. And we're usually pretty good about finding a spot for them. I think a bigger issue sometimes is that some clients are not ready to deal with their hepatitis B infection. Either they don't feel like it's a problem or they have too much else going on in their life. So it can take months of follow-up phone calls, and sometimes they'll tell you to leave them alone, and you leave them alone, and maybe revisit a couple months later when they might be in a better place and more willing to accept a referral.
Great. And Hong, is your clinic able to handle folks that you found tested positive? And do you have vaccination? Do you have the, I guess, capacity to vaccinate them at your clinic?
Yes. Yes, that's a very good question. I think it is very important to follow up with the clients who are carriers or who need immunization. We have, like I said, we have a monthly hepatitis B clinic. After the screening, we send the translated lab reports to everyone, to the clients who had screening from us. Then we will call each individual carrier to come back to see our doctor. So we are very fortunate to have a volunteer hepatologist, Dr. Kobe, from Northwestern University Legal Center, to come here regularly on a monthly basis to see our patients. And then the majority of our patients don't have health insurance. but of course not everyone needs medication. So for those people who have no insurance but need medication, we are fortunate to work with Gilead to apply for the patient assistance program to get a free medication for our patients. And for those who do not need medication but may need further tests, we provide DNA tests and AFP and other tests and liver function tests. They pay a discounted for the test, and then after 6 months, we invite them to come back, or 1 year to come back to get a liver function test. For people without immunity, we have also monthly immunization clinics. So we will call each individual to come back for the 3 shots. The vaccine is provided free of charge from the Chicago Public Health Department. And then, like I said, we have volunteer students to provide immunization. So we have been doing this on a regular basis, which is very fortunate that we rely on volunteers to sustain the program. The patients, most of the patients come back for re-screening for DNA or other liver function tests. Of course, we lose some of the people for the immunization for some reason. A few people, they just don't think it is important to get vaccination, and then we lose some people. But about 70% of people come back for immunization.
Okay, that's good to know. And finally, Ben, what has been your strategies for linking people to care after they get screened?
Well, we work closely with UCSD, so I send them the results, and they have a system where they catalog the results according to 5 profiles, and each profile would have a letter of notification. For people who are positive, then they would make a phone call, and if the patient needs translators, they have the capability to link with the interpreter on the spot. Yeah. About the questions that they often ask, they ask where are the vaccines provided and how much does it cost. And sometimes the infected individuals cannot pay for the more expensive tests. So they kind of stay away and do not follow up on their case.
Great, thank you. So we do have a question. I do want to get to a question that we got in from the audience. The question is, how do you handle patients who reject conventional treatment and stick to herbal therapy?
Maybe give some answer to that. Yeah, I really do not like the herbal medications because we don't really know what goes in there. And some people spend a tremendous amount of money to buy those medications, so-called medications. And when the disease has gone too far, then it is too late to do any reversion.
Has anyone else encountered patients who reject, say, Western medicine? Have you tried experimenting to sort of do some hepatitis B education and about what happens after you get infected and why you need proper treatment? Sherry,
yeah, we've tried some ongoing one-on-one education. It's really hard to overcome beliefs from someone's entire life. It's not easy in a couple of short phone conversations to do that. But we do try. I think education is key. Talking without putting, you don't want to scare someone, but giving them clear information on what the medications are and how helpful they can be. It is the only thing that's I think might work at this point. The other thing we've tried to do is potentially you can have a physician. You know, if you have a physician at the screening who is respected in the community, and we have a couple of physicians in Philadelphia who are just really respected in the community, if the physician might be willing to speak with them about it, that might help more than you speaking to them.
Yeah, in Chicago, we do have patients who are influenced by the advertisement and then thinking taking herbal medication eventually can eliminate the virus. We provide a very comprehensive individual counseling education, and the doctor would educate them and say it's almost a very small chance that you eventually will get rid of the virus by taking the herbal medicine. So for patients, because we do DNA tests, we evaluate their viral level. So they usually our clients are very accepting of our education, individual counseling, and usually they would follow up with our doctor's recommendation.
Right. So education is definitely key. And I just wanted to remind folks in the audience, if you do have questions, feel free to submit them via the chat box. We do have quite a few minutes left to take questions from the audience. Speaking of barriers, I just wanted to ask about the different communities. You all have talked about different Asian ethnic groups that you are serving in your communities, and have done a number of screening events in those different communities. Have you encountered a community that has been harder to reach, and why do you think so, and how have you overcome those barriers? And I'll go to Jane.
So every community is unique in its own sense, and I think the most important thing that we found is getting to that community leader who we can educate them, and also we can get their buy-in. So they really know that, you know, this really affects their community. I hate to say this, but you see, we've been trying to reach out to this Catholic church with Vietnamese community, and we all know the Vietnamese community is a good community to reach out to. They are very responsive. But at this church, we were just not able to do it until we went there once, and it was like there was only 20 people showed up. But then recently, there was someone passed away. One of their members passed away with hepatitis B, and they've been calling us to go back and do the screening. You know, so and that's it's I hate to say that you know, it takes that to make people aware. So sometimes the community leaders are the ones that they have their personal experience, like the Islamic Center. We've been going there and reaching out to them, and they just not very responsive until one person, one of the leader, his brother passed away with Hep B, and they also know that this affects their community. You know, when they go on Hajj, they have to shave, and they share their razor blade with everyone. They line everybody up, and so they know that hepatitis B affects that community too. But it's we were there last month, and we were able to screen 30 male and 15 females, and it's a big center, and that was the only number we were able to do. You know. So every community is really, really hard. It's unique in its own sense. The Laotian communities, we've been reaching out to them for 2 years now, you know, and finally we found a leader in that community who's very respectful by the community, and she's really very interested. And then now we are able to tap into the Laotian community. So I think it's getting the trust building the trust and being there. We're there every year for 2 years, and we screen 20, we screen 15, and then this year we're able to screen a lot more. So every community is kind of unique in its own way, and they're all difficult.
And 20 is not a bad number.
It's really bad when we have to, bring everybody to go. But it's not a bad number. We're there. Even if we say one person, it's a save. It's good.
Yeah. Sherry, have you had some of those experiences?
Yeah, so the Filipino community in Philadelphia has been here a really long time, and they've been less receptive. First of all, they're not as organized with community-based organizations because they don't need to be. They're fairly well linked into services, which is basically what they told us when we tried to reach out to them. Thanks, but no thanks. We have what we need. Some communities it's not so much that they're resistant, it's just that they don't have enough infrastructure yet to reach out to them. So for instance, in some of the Burmese, Bhutanese, and Nepalis refugee communities in Philadelphia, there are a couple of organizations that serve them, but not necessarily enough infrastructure to reach a number of them and be confident that we could link them to care. And so that's been a problem. We haven't had any communities outside the Filipino group turn us away. Some communities are more eager than others because they are well aware about hepatitis B. They may not have the most accurate information, but they know people die of hepatitis B. And so I think the communities that have more knowledge at least in Philadelphia, have been more likely to participate.
Great. Yeah, and it sounds like community leaders is the key to get into a community. So finding that gatekeeper, if you will, that trust.
Absolutely.
And so in our last minute or so, I wanted to go around and just to give folks in the audience your parting advice, I guess, if there's one takeaway, that folks in the community who are working at community-based organizations who are interested in getting involved in hepatitis B or want to increase awareness in their own communities and want to conduct a screening, what's your parting advice for them? And I'll go to Hong.
Yes, I think that they build infrastructure with the community and with other resources is very important. Because the Hep B is not just the education, it's not just the screening or just the immunization. And it's a whole bunch of related activities from education, screening, follow-up, immunization, patient care, and follow-up again, because we need to sustain the program and to bring the patients back to do follow-up care. So, but without a good infrastructure, you are just doing something here and there. It's not effective to really improve the health. Doing infrastructure building, you have to work with multiple partners, with resources. We feel we are very fortunate to link with university resources where you can get continuous volunteers. We can do the regular screening, immunization, patient care. It's because we have a good relationship with universities who take this project as their own project rather than as our community project. The Hepatitis B Alliance is a student-run organization, so they take this project as their mission. So they are committed to raise funds. They are committed to pass on the leadership to next leader. The students, the first year they have more time to do community work, but after they go to the third or fourth year, they are gone. So they pass on the leadership to next generation, providing orientation and commitment. that's why we can sustain the program with the ongoing activities. But if we don't have a good infrastructure, we just do this once in a while. That's not effective. We lose patients, we lose time.
Absolutely. And I do want to echo that point. If you're going to conduct hepatitis B, those that test positive need to get treated and care, and you're absolutely right. And you need to have that infrastructure to follow through and get those people treated. Ben, advice from you, if there was one key takeaway?
Okay, please be aware of it and get screened, because 1 of the 12 Asian people are affected. And that is the one we can prevent with vaccination and being careful on your liver, because that is a very important organ to our body. Okay.
Thank you. And Jane?
So once you have all your infrastructure ready to go, I would say that perseverance.
Yeah. Yes, and you have a lot of perseverance. We've heard from all of you how hard it is to just get out there, get the trust of the community, right? And
That's right.
to be able to reach these communities that you may not be a part of yourself. So, and you've done such a great job. And Sherry?
Yeah, I would echo that. I would say be patient, be persistent, and be inclusive. So patience, it may take a long time. It took us 2 years before our project even got off the ground, because we were developing relationships. And that, working with the community, knowing the community, that part's really important. And yeah, be persistent. You're going to hear no a lot, and you'll get people who won't call you back, and you'll have some screenings where 6 people show up. But if you keep at it, it will, you will have them knocking down your door at some point. So just keep going.
Great, thank you. I just have one last question from the audience, and because it's one last question, I'll take it before we close out. And this person is asking any advice on how to get accepted by the Midwifery Association. And I'm not sure if that means the person is asking if you worked with midwifery associations.
I think in terms of perinatal hepatitis B, so preventing mother-to-child transmission, we'd like to work with professional organizations just for information and partnership. I haven't. I don't even know if we have a local chapter, but I'm going to look it up.
Yes, that's a good point. And just so for folks in the audience know, it's a common method of transmission. Is that that's right for the Asian populations? Lots of times it's contracted during birth, and so that's a great point. And so if you are from a midwifery association and want to get into contact with us, we'd love to connect with you. And finally, I wanted to go ahead and close out. I wanted to thank all of our speakers for your time and for your expertise and advice today. And just if anyone has any more questions, please feel free to reach out to us, and I will go to our contact information here. And we can be reached at, there's a lot of slides, connect@hepbunited.org. So please send any follow-up questions, and if you would like to get in touch with any of our speakers, we're happy to do so. And I want to thank you, Jane, Ben, Hong, and Sherry again for joining us today. And everyone, we hope that these chats do provide you with useful tools and insights that you can use in your own community. And please keep a lookout for a follow-up message. We will be sharing a copy of this recording with you, and also a copy of the presentation slides as well for future use. Thanks again for joining us today. Have a great rest of the day.
Thank you, everyone. Thank you.
Thank you.
Thank you. Bye.
Bye-bye.